Brian Lehrer on WNYC. And for trans and gender nonconforming New Yorkers, the question of where to get medical care has gotten a lot more complicated this year. The Trump administration has been pressuring hospitals to stop offering gender-affirming care to minors and investigating the ones that do. Here in the city, two of the biggest hospital systems, NYU Langone and Mount Sinai, have pulled back that care for kids, and both are now caught up in a new wrinkle in this. It's federal subpoenas for their patients' records. Federal subpoenas for their patients, these minors' records. At the same time, the Mamdani administration said it's committed to protecting this care. The city is preparing to offer hormone therapy to trans adults at its own clinics, including a new health center in Corona, Queens. Tish James, the state attorney general, is telling NYU Langone, no, you have to continue offering this care. So at least that hospital is caught in between the federal and state governments. But what the Mamdani administration is offering to trans adults won't extend to minors, at least not yet, and advocates are watching closely as the city finalizes its budget at the end of the month to see if anything like that is in there. So here to walk us through some of this and to take your calls if you're involved in this at all as a trans person yourself, as a family member, as a medical provider, Caroline Lewis, healthcare reporter for WNYC and Gothamist. Hey, Caroline, welcome back.
Hi, Brian.
So let's talk about this subpoena issue. For people who don't know, last month, NYU Langone first raised the alarm bells when they announced that they received a subpoena for the medical records of patients under 18 who received gender-affirming care. Where is this subpoena coming from, and what's the rationale?
So the subpoena came from the U.S. District Attorney for Northern Texas, and it's actually one of many federal subpoenas from Trump's Justice Department that have been issued to hospitals under his second term. But lawyers I spoke to said this represented sort of an escalation because it was a federal grand jury subpoena, which is typically issued in a criminal case as opposed to a civil case. But, you know, it recently became public because it was included in a lawsuit, and I think it offered a lot of insight into what the administration is actually after. And it's really like a vast trove of records that they're seeking.
What do we mean by patient medical records? What kind of information is the DOJ actually looking to receive from these hospitals?
Yeah, so it's a variety of records and information. First they specifically said they want identifying information about minor patients who received services such as puberty blockers or hormone therapy over the past 6 years. The Trump administration refers to that as sex-rejecting procedures, but, many medical providers call it gender-affirming care or treatment for gender dysphoria. They're seeking the personnel files of anyone who provided or even billed for that care. And then they're also seeking a lot of documents that seem to be related to hospital practices around providing and billing for this care. So they want diagnostic codes. They want to know, what kind of informed consent was required, documents that parents signed off on. Were there any adverse events? So it's really vast.
And what's the risk to the patients, to the minors themselves or any family members or the medical providers? Why is there concern about this? What might the federal government do with this information that could actually hurt them?
We don't know. We don't know how it's going to be used. But I think, I spoke to parents who said, one parent said, well, my trans son has, a passport that has his correct gender marker on there. If they get his medical records, will they, next time he has to renew his passport, will they say, oh, actually, now you have to say you're female? Parents certainly raised concerns. Are they trying to come after us and charge us criminally in some way? But I think, what is clear is that the Trump administration is also trying to just get more information about hospitals' practices here. And I think, they have been building this case, since Trump took office to try to show that, gender-affirming care is just not legitimate and to try to, basically block hospitals from offering this care.
But they may have this policy dispute or, social values dispute on some level. But why is it the Justice Department seeking these medical records? When the Justice Department investigates something, it implies there might be criminal activity.
Yeah, I mean, the Justice Department has not directly commented on this, but like I said, they have had a broader campaign to try to block gender affirming care in the Trump administration. And so it seems like this is just sort of one arm of that, on the HHS side, they've, proposed rules to block federal funding from going to hospitals that offer this care. And both Mount Sinai and NYU Langone actually pulled back on offering gender affirming care to minors earlier this year, just in light of, possibly in light of those proposed rules, even though they were never finalized. And so this is another part of that. And so it might be that they're investigating the care. It might be that they're trying to have the intended effect of, chilling this type of care from being offered.
We should tell our listeners, and also to give you and your reporting credit, NYU Langone had announced that the Justice Department was seeking this, particular patient and provider information involving gender-affirming care for trans youth. But then last week, you broke the news that Mount Sinai received the same subpoena, but this time the information didn't reach you via announcement, right? So how did you get that story, and what do you think the significance is of there being yet another hospital being subpoenaed, and maybe the fact that they didn't announce it on their own?
Yeah, no, it was interesting. So NYU Langone, both hospitals had to legally had to inform patients that they were being subpoenaed under state shield laws. But NYU Langone, like you said, posted it online, was very transparent about it. And then, there was a class action lawsuit filed by trans New Yorkers and their parents to try to block these medical records from being shared. Mount Sinai, on the other hand, had social workers sort of individually calling up parents or patients directly saying, your medical records have been subpoenaed. They could be shared with the federal government. We're going to anonymize them. But they didn't put anything in writing. And when I initially reached out to a spokesperson, she declined to comment or, even confirm that there was a subpoena. Eventually, more outlets reached out and they were forced to say that, yes, the subpoena exists. And they made it seem like less clear that they were definitely going to comply. But it just struck me that, they were not being transparent about this. Even lawyers from Lambda Legal, which filed this class action suit against NYU Langone, said they had heard rumors that Mount Sinai had a similar subpoena, and they tried to word the lawsuit so it would apply to them too, but they weren't even able to confirm until we sort of forced them to say it via our reporting. And so it just struck me as like a different level of transparency.
And listeners, anybody involved in this issue personally want to call in or text 212-433 WNYC 212-433-9692 with our healthcare reporter Caroline Lewis, who was involved in breaking the Mount Sinai portion of this story, as you were just hearing. Tell us what you think this means for you or your loved one or your patients, 212-433-9692, or what anybody can do about it. We are getting some texts already, several of which are asking a version of the same question, which is, isn't this a violation of HIPAA, the medical privacy law, that the government can just come looking at your personal medical records?
I will say, I think that, I need to dig more into exactly what the HIPAA laws say about this. I think, the DOJ made the case in the subpoena to NYU Langone that there's exceptions that they're able to exploit here. But certainly the class action lawsuit argues that this does violate physician-patient confidentiality under state law, as well as constitutional protections around privacy and, searches and seizures. And so I think there are, there's definitely conflicting legal arguments here.
Let's take a phone call from Annabelle in Brooklyn. You're on WNYC. Hi, Annabelle.
Hello. I'm in community with parents whose kids have been caught up in the subpoena. Amongst these parents, trust with NYU and Mount Sinai has been shattered, and people have been looking to New York City admin for a proactive response. But a fundamental concern is the lack of communication to and from the mayoralty on this crisis as a whole. What advice would you give to the city government to establish better communication with those directly affected?
That's a good question. I mean, I think in general, there's often this like feelings when issues like this come up that, policymakers might be trying to help, but they're not necessarily talking directly to those affected and involving them. And so I think that's always, a valuable thing to have people's voices who are on the ground. Certainly the Mamdani administration, Mayor Mamdani has said he's putting up $15 million over the next 2 years, or that's what he's proposed in his city budget to expand gender affirming care. He said he wants to provide services specifically for kids. But, it was interesting. There was a city council hearing on the health budget the other day, and the health commissioner said, that the administration is still really figuring out how to provide that care or expand access to that care without getting federal backlash, without having federal funds clawed back. And so clearly there's, some strategizing going on behind the scenes. And I think we have to really see what comes out of this.
Annabelle, thank you very much. As a follow-up, Mayor Mamdani was on the show last week, and we had a caller named Reina, the parent of a trans child who lost care at NYU and is now caught up in the federal subpoena. And she told the mayor her community needs more than words, concrete legal protections, and city dollars are what they need. And when we pressed them on how specifically the city would reopen access for trans kids, here's 20 seconds of what he said.
The $15 million that we have committed is funding that would unlock exactly that. And it speaks to the fact that whether it's Reina's experience or so many others across the city, there are explicit consequences from both the cruelty that we're seeing from the federal government's policies and the decisions that are being made by private healthcare institutions here in New York City.
So we just heard the mayor make his case for that $15 million of city funding being meaningful. You report it's a steep drop from the $65 million he pledged as a candidate. But I guess I would repeat the same question that I asked him that I don't think he quite gave a specific answer to, which is, even with that money, how does it unlock the care for future trans minors if these hospitals are too scared because of what's going on in Washington to provide it?
Yeah, I think there's a few different ways the city could go. The health commissioner did just announce that city-run clinics are going to be providing hormone therapy for adults and not yet for adolescents because, again, they're still sort of figuring out what makes sense. So they could try to offer that care themselves. They could provide funding to nonprofit providers or community groups that are offering this care or to maybe expand their services in light of some hospitals pulling back. Like I know that, Callan Lord and Planned Parenthood offer some of these services to adolescents, but it might not be as robust as what Mount Sinai and NYU Langone were offering. Like I know at Planned Parenthood, for instance, they have hormone therapy for 16 and 17-year-olds, but not necessarily for, care for younger children. So I think there's different routes. And, I know the federal government threatened funding for hospitals, not yet for other types of providers. So maybe they want to sort of roll the dice and see if it's, if other types of providers can provide this care without that backlash.
Here's a text that I think comes from the same parent who got to ask the mayor the question on the show last week. And she's putting it here into an even broader perspective. Listener writes, as a parent whose child is caught up in this subpoena, I want to remind everybody that my child's care is legal and protected in New York. If the government can do this to trans kids, they can do this to anyone. Abortion care, antidepressants, vaccines are all under attack by the federal government. Trans kids are being used to erode privacy rights and medical norms. And yeah, she did sign it, Reina, in Brooklyn, so that's probably the same person. But Caroline, that's, a pretty sweeping theory there, that this isn't just about the dispute over what's legitimate to do medically to minors, but a larger invasion of the right to privacy in the medical world, moving toward some of the conservative agenda to limit vaccines and abortion care and other things. I don't know if you've done any reporting that would suggest it's in that broader context, but what are you thinking? Hearing that text?
Well, I think I do think it's relevant to talk about the significance because, trans people are such a small minority and trans children are an even smaller minority. And so some people might feel like, well, this doesn't affect me, or it doesn't even affect that many New Yorkers, right? Even though New York has been traditionally known as like a haven for LGBTQ plus people. But I think there is that argument that this is part of a broader trend. We do have a state shield law related to gender affirming care, and we have shield laws related to abortion care because we've also seen, efforts from other entities in other states to try to prosecute, New York providers who are like sending pills across state lines, right? So there is this idea that even though, that we can't necessarily decide that we protect certain types of health care, because there might be efforts by the federal government or by out-of-state entities to try to erode that care. And so I think there is this idea that that there's a need to sort of stand up to those efforts.
You reported that New York lawmakers, including Representatives Gerald Nadler and Alexandria Ocasio-Cortez, are urging NYU Langone to, quote, fight these ill-conceived subpoenas to the fullest extent of the law, unquote. Maybe I'll get to ask the 5 Democrats running to succeed Gerald Nadler what they would say about that when I'm one of the moderators in that debate tonight. But what could that fight look like? What do you think they mean by that specifically? And do either NYU or Mount Sinai have an appetite for that fight based on your reporting?
I think what that means is that they should not comply in advance. I do think there's a sense that both Mount Sinai and NYU Langone complied in advance with federal threats to their funding that never really came to fruition. And there's this, feeling that they should not comply in advance with the subpoenas. Both hospitals have, I don't think either hospital has, sent medical records yet. Both have framed it as like something that could happen. But certainly, I asked one city council member, what does it mean to sort of fight back? And this was Tiffany Caban, and she said they should lawyer up. They should, fight in court the way that patients are.
Emily in Maplewood, you're on WNYC. Hi, Emily.
Hi, how are you? Thanks for taking my call. I am calling because I moved to New Jersey from Texas, and we have seen what has played out in Texas. In 2023, when we left, records were being subpoenaed at hospitals there that ended up being turned over. Texas, of course, put up zero fight. And now they're opening a detransitioning center, and they have names of parents and youth of transgender Texans. And that's terrifying. I ultimately think that's what's playing out in New York City, where they're going to come in slowly, step by step, and the Trump administration will pretend that, this is not just to have a roster of names of who trans individuals are, but I think ultimately that is what they are wanting.
Emily,
that when the time comes...
Go ahead.
Yes.
They can do the same thing.
I'm just worried that when the time comes, they're going to have this list of names.
Yeah, and what's your concern about what they could do that's harmful to the individuals involved with that list of names? I mean, one could say, all right, open a detransitioning center. Some people will want to detransition. That's their right, just as getting the initial gender-affirming transitional care is their right. But what can they do with the names that's harmful? Do you have a sense of that from your experience in Texas?
Yes. So in Texas, parents who seek gender-affirming care, even through a therapist, is considered child abuse. So your children can be removed from your home. When we left Texas, Ken Paxton, the goal that was communicated to Child and Family Services at that time, or Child Protective Services, was you automatically open a case for child abuse if someone calls suspecting that a child is receiving gender-affirming care. And it just include going to therapy, not even like physical transition. And so I think that if, ultimately in the future, if they actually get through these, we made it past the first step, these hospitals are backing out and they're going step by step. The ultimate goal we've seen play out in Texas is that it's considered child abuse. They can remove the children from the home. They can be placed in foster care or group homes, which is truly absurd. We're just talking about medical care for our kids that is desperately needed. I do think, of course, people can transition if they need to. That is an astronomically tiny amount of people who choose to detransition. And the only process to detransition youth is just stop taking the puberty blockers, stop the hormones. There is no need to seek further medical treatment if you decide to detransition. So no medical intervention is needed. There doesn't need to be specified care for that.
Center.
You just stop taking the medication.
Is this why you moved from Texas to New Jersey, having a trans daughter, because you may have
100%.
been declared a criminal under Texas law?
Yes, we had to leave because we could have had our daughter taken away from us. We were not able to sell our house and leave until a couple months after the law went into effect. And I sent my daughter to school with a script for her to read to Child Protective Services if they showed up at her school to interview her. Wow. And it was terrifying. We spent 2 months of sending her to school that way, and we left. We didn't know anyone in New Jersey. We had to leave our entire supportive family and friends, our community that was beautiful, and we came to New Jersey by ourselves just to be able to be safe and keep our daughter in our family and with us.
Wow, that is some story, Emily. A tragic story. I hope you get a lot of community support there in Maplewood.
We do.
Good. Can I ask one other? And moving there when you don't even know anybody there, you said. I mean, it's just incredible what you had to do because of this. I want to ask you one more thing, sort of a curious question, if you even have a sense of this. Why? Okay. What do you think motivates those who would want to label you this way and other families with trans minors? If what we're talking about is parents who love their children making what is always a very difficult decision. I'm sure it was not easy for you to say, hey, let's go through a trans process of whatever kind you were doing. You're making this decision because you love your child and you want to support your child, and you're doing it in collaboration with medical professionals, like in New York, the people who might work at Mount Sinai or NYU Langone. And yet, there are those who want to criminalize this anyway. What do you think actually motivates them? Is it religion? Is it what? You have a guess, a sense, an opinion?
Yes. I mean, that's truly a huge question where if we start pulling the string, I can go on. If I really pull the string, we'll be here for like 2 hours. But I think immediately it is fear and lack of understanding. And I think that I think fear and lack of understanding are the individuals who support the Trump administration. The administration themselves, I think its terror is a primary goal, right? I don't really believe that there is a single politician or a single person in the Trump government who genuinely care. Like, if they heard my daughter's story, they do not care either way whether she is trans or gets medical care. But as long as their base is terrified, as long as everyone is terrified, they get to retain power. I think it's about power. I think it's about control over people and wanting people to perhaps go back to some idea that there was once a time in this country where men were men and women were women, and men worked and women raised children, and we had people in the labor force that were not highly educated. I think that ultimately that's what they believe is making America great again. And as long as people are living their beautifully diverse and powerful truths, they don't have that labor force. They don't have those clear roles for every single family. And they don't want to, have people actually living their personal lives and not contributing to the capitalist framework that we have, right? Like, capitalism isn't going to be sustainable as long as everyone is self-actualized and allowing this diversity in our culture and our humanity.
I didn't think you would get to that global a critique, but Emily, thank you.
I told you I could pull this thread.
I know, for 2 hours.
This thread really goes hard.
Well, I don't think anybody listening to your call could doubt that you have the best interest of your child at heart. At very least, we really, really appreciate your call. Go ahead. You wanted to tag it with one thing? Can
I make one more comment? My daughter is getting to live this very joyful childhood, and I really just want to comment that, these kids out here, these trans kids, maybe we get this narrative from people who don't understand that these are depressed, miserable children who are just tormented and bullied and, actually supporting their transness is continuing this dark mental health journey. But actually the opposite is true. All of the supported trans kids I know are just these incredible, beautiful kids who are delightful and such the brightest spot in my life, and getting to witness them, my child and her friends. So I just really wanted to speak against that narrative that there is just this real darkness attached to the trans experience.
Thank you for doing that. How old is your daughter now?
She's about to be 14.
Emily, thank you very much. Good luck to you and your family. And wow, Caroline, what were you thinking listening to that call?
I mean, that was incredible. It made me want to, really do a bigger deep dive into what's happening in places like Texas. That was such an incredible story. And it also, made me think there at the end about the parents that I've spoken to in recent days, about what their children's journey has looked like. And, I think what everyone sort of emphasized is this was not an overnight decision that they needed, hormones. It was the result of years of experience where one parent said, my child has identified as a boy since he was 3 years old and could, basically say, call me a boy. And, it took until he was maybe, 14 or whatever to start getting hormones, 14, 15. Another parent was telling me it was a very different story, but similarly a long journey to getting this care, where he said his child, who's now 20, around 12 or so, was, really depressed, suicidal, self-harming. And it took years of therapy to get, this child to say, that they didn't feel like a boy or a girl, and to ultimately, get approved for the care that they got, which they, are getting at Mount Sinai. And so I think it really just speaks to that, this idea that these parents know their children well, and that it's not just something that was pushed on them.
I'm sure, though, that some listeners reacted to the end of the call, hearing how young her child is, 13, about to turn 14, and already going through some kind of medical gender-affirming care. But for you as a healthcare reporter who's looked into this, I guess, can you explain how it's complicated at that age? Because is it true that if you don't do something by the time of puberty or the earliest moments of puberty, then it's too late?
I think it varies for each person. I think the idea is that, the idea of puberty blockers is that you can give them when they're younger, 12 or 13, and then that'll sort of hold off puberty while they decide, if they want to go on hormones or take some other step. And the idea is that, then you can discontinue it, and it's sort of reversible if they decide, not to proceed. But I also have talked to people, even teens who, throughout reporting, who have said, who have identified for a while as trans, but never did any medical intervention, and eventually decided to go on hormones or something like that. So I think it really varies person to person.
You know what? I want to extend this by one caller past our scheduled time, because we have Elizabeth in Inwood who says she works at Mount Sinai and may be able to help you report the Mount Sinai story, Caroline.
That's great.
Elizabeth, thank you for calling in. What's your relationship to this issue?
Hi, Brian. Thanks for taking my call. I just want to say quickly before I begin that I'm speaking on my own behalf, not on the behalf of Mount Sinai. I was one of the lead clinicians of the Gender Care Center at Mount Sinai for many years. I'm no longer in that position. And I was responsible for quite a lot of the care that was delivered there during my tenure. I do adults, so I was not directly involved with the adolescent care. Obviously all of this is infuriating because the evidence is really very, very clear that interrupting puberty, particularly in people that are assigned male at birth, is really critical to positive outcomes. There are certain structural changes in the skeleton and other places that once they occur, they really can't be reversed. We have some surgical techniques and things that can sort of abate them later on in life, but the best chance that we have for people to assimilate into their internal gender, their gender identity, is by preventing the sex development in the first place. And so when we talk about this scary delivering gender care in adolescence, what we're actually just talking about is delaying a puberty that would cause them to develop into the wrong body. If the person were to choose, a family, to stop that treatment, they would simply go along the path that they would have. So if a sex-assigned male at birth were to delay puberty for a year, they would, and then decide that that no longer fit them, they would simply then begin their male puberty again. There would be a delay in terms of maybe social development and, not keeping up with their peers and so forth. I will say that happens very, very rarely, but it's not a zero number of people that decide to, stop that treatment. The numbers of people who identify young are not the majority, but the numbers are increasing. But the main point is that by targeting the adolescents what they're doing, in my opinion, is they are taking away the best possible chance at integrating completely and fully for especially people assigned sex male at birth into an adult life that is sort of integrated fully, invisible. It's almost like they're purposely creating a situation where forever forward it's going to be possible to identify this class of people as transgender. That's my first point. And the second I'll say,
go ahead.
Go
ahead, real quick.
Yes.
Real quick.
I was just going to
make a second point.
Yeah, I was just going to say really quickly, the other part of that is that it seems like the conversation never encompasses trans men, trans boys. Everybody is focusing on trans girls when there's this whole other cohort, and that makes me think that this is a wider issue around marginalizing women, and that the easiest way to marginalize women is to pick off the most vulnerable of the population, which are trans women. But I'll stop there.
Caroline, do you, as a reporter on this beat, have any question for this caller?
I have a lot of questions I'd love to follow up afterwards, actually. Yeah, I think in general,
happy to share my information off air.
That would be great. Yeah. I think there's just so many angles to this. Like, I am curious, behind the scenes how hospitals are handling these things. I also have a lot of like medical questions, and I've obviously done research on transgender care over the years, but like still I think that the science on this is also still like evolving, and there's a large consensus among major medical groups that like this type of care is valid, but like I also am so curious. I still have questions too,
All right. So I will let you two connect off the air. If you want to leave your number, Elizabeth, with our producer, and we will leave it there for now. And Caroline, will be interesting to hear what you might learn about, things she probably wouldn't be comfortable as a Mount Sinai employee saying publicly about how the hospital is planning to fight or trying to continue their care programs despite currently suspending it under threat from Washington, or what to do with the subpoenas for the individual's medical records. But we will leave it there for now with Caroline Lewis, healthcare reporter for WNYC and Gothamist. Caroline, thanks a lot.
Thanks, Brian.